November is Lung Cancer Awareness Month, and screening for cancer could be a life-saving move for you or someone in your life. Doctors Daniel Quadrado and Luke Seberg with Virginia Mason Franciscan Health are here now to tell us more. Thank you to you both for being here today. Such an important topic. I want to start with you, Dr. Seberg. Why is it so important for us to talk about lung cancer screenings?
Yeah. So lung cancer affects about 50 of every 100,000 Washingtonians. And lung cancer in its early stages is very, very curable. As it becomes more advanced, it becomes less and less curable, still treatable, but not necessarily curable. We have a lot better options early on. And since it has no symptoms in its early phases, the best way to detect it is through screening programs.
Gosh, that's what I was going to ask. So there's no way of even really seeing something and popping in. You just have to stay on top of screening. Yeah. Dr. Quadrado, I want to get to you. What should people know about what types of screenings are out there and available?
Yeah, really, now the best screening that we have is doing a low-dose CT scan. So it's really not much more radiation than a CT scan. It's a discussion you have with your primary care doctor if you meet the criteria. And the test takes about 10 to 15 minutes. It's something that you can go get your scan done and go about the rest of your day and get those results back from your primary care doctor.
Amazing. And Dr. Seberg, how do lifestyle factors impact your lung cancer risk too?
Yeah. The number one risk factor for lung cancer development is smoking, either currently smoking or recently smoking. The more you've smoked, the higher the rates, but it takes very little to raise the risk of lung cancer. There are things that you can't control, like where you live, if you've been exposed to radon, and family history. So if family members have had lung cancer in your family, you're probably at genetically higher risk as well.
Okay.
And then there are occupational exposures like being around harsh chemicals, environmental exposures like the fire smoke that we get regularly exposed to, all can play a role. But the number one most important is your history of smoking.
And should we be screening every single year? I mean, where does that, timing come in too?
Well, the way that the screening is set up, if you are in the high-risk group, so between the ages of 50 and 80, smoked for more than 15 years, a pack a day, and are willing for treatment, you qualify for lung cancer screening. So the screening is geared towards the highest risk people.
Okay, and I want to stick with you, Doctor. Tell us about how treatment advancing for those diagnosed with lung cancer is going.
Yeah, so now if we find a nodule, and ideally we want to find it early, we have minimally invasive techniques to sample it bronchoscopically, where that's also done as a same-day procedure that allows us to diagnose and stage someone in one setting. And then for the treatments, if you're a candidate for surgery, surgery is still the best treatment we have for lung cancer. We do those operations in the least invasive way possible with a surgical robot. So, on average, it's a 1 to 2 night stay in the hospital after your treatment.
After a surgical robot. Yeah. It's just wild with the advances too, with everything too. What do you guys think too is the key takeaway for viewers at home that are watching? What should people know?
So I think the most important thing to know is whether or not you qualify for the lung cancer screening programs. There are enrollment criteria, but you can actually just go online to vmfh.org/lung screening, and it lists them right there for you. And when in doubt, talk to your doctor and find out if you're a candidate. That is the most important individual step you can do to save your life.
Wow.
And the same, if you qualify for screening, get screened. If you have family members that qualify for screening, talk to them. This is a discussion you'll have with your primary care doctor. But if we have someone with symptoms from lung cancer, it's already progressed to a very advanced stage. So the earlier, the better we find these.
What are the symptoms when it has progressed to an advanced stage? Like, what are people dealing with then?
It could be things like coughing up blood, pain when you take deep breaths. But also, lung cancer is a disease that likes to spread through the body, so you can have symptoms depending on where it's gone in your body.
And online, I know people can go and kind of look at, the criteria, but do you guys, since we have some time, have anything that people should know about if they have family history or if they are a smoker?
So I think if they have, you're either currently smoking or have smoked in the last 15 years, there's a good chance that you're at elevated risk for cancer and probably would qualify for lung cancer screening. So as an individual, the simplest thing is, have I smoked sometime in the last 15 years? I should probably be checked out with my provider to see if I qualify.
Amazing information. Thank you so much for being here. We know that you all are very busy, so we appreciate your time.
All right,
Thank you.
Thank you.
And for more information like we talked about, you can visit the website that you see right there on your screen. That's vmfh.org/lung screening.
New Day Northwest is sponsored by Virginia Mason Franciscan Health.